said you are effectively denying people vaccines.
We're not going to recommend a product for which there's no clinical data for that indication. Is that what I should be doing?
What you should be doing is honoring your promise that you made when you were looking to get confirmed in this job.
You're going like this.
And that is, you promised that you would not take away vaccines from anyone who wanted them. You just changed the classification of the COVID vaccine.
I'm not taking them away from people, Senator.
It takes it away if you can't get it from your pharmacist.
Well, most Americans are going to be able to get it from their pharmacy for free. Most Americans will be able to get it from their pharmacy for free.
The question is, everyone who wants it, that was your promise, Mr. Kennedy,
I never.
Hey everyone, welcome back to the channel. Today we're diving into a heated Senate exchange that has raised serious questions about vaccine access, political promises, and public health. This back and forth between a senator and Health Secretary Kennedy is making waves, and I've broken it down into 10 powerful bullet points you need to know. Stay tuned, because the ending is intense. And before we jump in, don't forget to hit that subscribe button so you never miss out on updates like this.
Thank you, Mr. Chairman. So, last November, while you were under consideration to become Secretary of Health and Human Services, Mr. Kennedy, you said, quote, "If vaccines are working for somebody, I'm not going to take them away." No exceptions, no ifs, ands, or buts. You would not take away vaccines from anyone who wanted them. Then last week, you announced that the COVID-19 vaccine is no longer approved for healthy people under the age of 65. In announcing the change, you said the vaccine will be available for anyone who wants it. Now, obviously, both things cannot be true at the same moment. So let's clear this up right now, Secretary Kennedy. Will you tell America that all adults and all children over 6 months of age are eligible to get a COVID booster at their local pharmacy today?
Anybody can get the booster.
I'm sorry?
Anybody can get it, Senator.
Anybody. So you're saying that is now the official rule of HHS. Anybody is eligible to get a booster by just walking into the pharmacy.
It's not recommended for healthy people.
No. If you don't recommend, then the consequence of that in many states is that you can't walk into a pharmacy and get one. It means insurance companies don't have to cover the $200 or so cost. As Senator Dr. Cassidy said, you are effectively denying people vaccines.
We're not going to recommend a product for which there's no clinical data for that indication. Is that what I should be doing?
What you should be doing is honoring your promise that you made when you were looking to get confirmed in this job.
You're going like this.
And that is, you promised that you would not take away vaccines from anyone who wanted them. You just changed the classification of the COVID vaccine.
I'm not taking them away from people, Senator.
It takes it away if you can't get it from your pharmacist.
Well, most Americans are going to be able to get it from their pharmacy for free. Most Americans will be able to get it from their pharmacy for free.
The question is, everyone who wants it, that was your promise, Mr. Kennedy,
I never promised that I was going to recommend products for which there is no indication.
When you said...
And I know you've taken $855,000 from pharmaceutical companies, Senator.
Did you hold up a big sign saying that you were lying when you said that? Because you are the one who said you would not take them away. Now, Senator Kennedy,
I'm not taking them away from anybody.
Secretary,
you want me to indicate a product for which there is no clinical data?
Senator,
is that what you want?
Secretary Kennedy, you said you wouldn't, and now you did.
I'm not taking them away. Everybody can get access to them.
No, they can't walk into a pharmacy the way they could last month and get access to
it depends on the state. It depends on the states.
A year ago,
but they can still get it. Everybody can get it. Everybody can get it, Senator.
So look, let's move on. You clearly are taking away vaccines. I've seen the list for what's coming up next, and that is the agenda for the next CDC vaccine panel. And first up is ratifying your COVID actions. Second is hepatitis B is on the agenda. So should Americans expect you to take away hepatitis vaccine access as well, even though you promised not to?
As I said, I'm not taking vaccines away from anybody.
Okay, same answer, right? You're just going to deny that when people can't get access, that you're not taking it away. Then let me ask you, is that the same game you're going to play with measles,
you want me to recommend every product in the world?
No,
so that without any clinical trial data.
Through on your promises.
Yeah, my promise was to give.
A month ago, we could get COVID vaccines by just walking.
You can still get COVID vaccines, Senator.
You are taking that away.
No, you are You can still get the COVID vaccines, and Medicare will still pay for them, and Medicaid will still pay for them.
Tell the head of the CDC that if she refused to sign off on your changes to the childhood vaccine schedule, that she had to resign.
No, I told her that she had to resign because I asked her, are you a trustworthy person? And she said no. So if you had an employee who told you they weren't trustworthy, would you ask them to resign, Senator?
So I'm sorry, but this is not what she has said publicly. She has said
I'm not surprised about that.
So you're saying she's lying?
Yes. Every conversation I had with her, there were witnesses.
Let me get this straight. This is the same person that less than a month earlier, you stood next to her and described her as unimpeachable, and you had full confidence in her, and that you had full confidence in her scientific credentials. And in a month, she became a liar?
Yeah, you should ask her what changed. And by the way, a month ago, you were voting against her. Oh, because you thought she was either incompetent, ineligible, or unsuited to the task.
I voted against her because I was afraid she was going to bend the knee to you and Donald Trump. And it looks like she didn't bend the knee, so you fired her. Look, you're putting America's babies' health at risk, America's seniors' health at risk, all Americans' health at risk, and you should resign.
Senator Sanders.
So let's start with the big issue. Last November, Kennedy promised that he wouldn't take vaccines away from anyone who wanted them. But recently, he announced that COVID vaccines are no longer recommended for healthy people under 65. That's a sharp shift, and naturally the senator called him out for going back on his word. Kennedy kept saying, anybody can get it, but then he clarified, it's not recommended for healthy people under 65. Here's the catch. If it's not recommended, pharmacies in some states won't provide it, and insurance companies don't have to cover the $200 price tag. The senator argued that this isn't just a recommendation change, it's effectively limiting access for millions. When pressed, Kennedy defended himself, saying he couldn't recommend products without supporting clinical data. But the senator pushed harder, pointing out that Kennedy had accepted over $855,000 in contributions from pharmaceutical companies, suggesting possible conflicts of interest. The room grew tense as both sides argued over what availability really means. The senator warned that this could go beyond COVID. Next on the CDC agenda is hepatitis B, and the senator demanded to know if Kennedy would restrict access to that too. Things escalated even further when Kennedy was accused of forcing the CDC head to resign after she allegedly disagreed with his policy changes. Kennedy fired back, claiming she wasn't trustworthy. By the end of the exchange, the senator flat-out accused Kennedy of breaking promises, endangering the health of babies, seniors, and all Americans, and called for his resignation. Kennedy, on the other hand, stood firm, insisting vaccines are still available, even if not recommended for certain groups. So, what do you think? Is this a matter of protecting public health through data-driven decisions, or is it political maneuvering that limits access to critical vaccines? Drop your thoughts in the comments below. I'd love to hear your take. And if you found this breakdown helpful, hit that like button, share this video, and don't forget to subscribe for more in-depth coverage on issues that affect us all.